The child should not first be hearing about the vaccine when they show up at a provider's office or at a pharmacy. Usually, I recommend parents talk to the children in the days before about the vaccination coming up. Explain to the child that the pain of the injection will come and go, but the benefits are long lasting. Teach them that the vaccine teaches the body to defend against the germs and the harms that these germs do. If you or your child has a question that you're not handling well, that you're not getting the answers that you need, or your child is not understanding, bring in your child's healthcare provider. They should be a part of your decision making of how you pursue preventive care for you and your family. And this is a very important issue. We are suffering a pandemic right now. Your children and their livelihoods are at risk. So get that healthcare provider involved if you get stumped. Serve as an example to your child by getting your vaccine, staying up to date on your vaccinations, and sharing your experience with them. These are all things that you can do to prepare your child for the COVID-19 vaccination, as well as other vaccinations that the child will be due for. Demonstrating appreciation for their child getting vaccinated actually go a long way to reward a 5 to 11-year-old. Or you need to remember, developmentally, these children are looking to demonstrate some mastery, to be growing up. Talking to them about how this is a step of maturity, how this is very grown up of them, this is very mature. Those are words that reward the child who is 5 to 11 years of age, that they're doing the right thing.